Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop jaw pain. This is a very special topic to me because my wife used to suffer from chronic jaw pain and locked jaw. And I tried with her a lot of different techniques that I learned in the school. I took specialty classes, read a lot of books, but unfortunately I was not able to relieve her symptoms long term. And one day she had a locked jaw and she asked me to try anything, and that's when I started to experiment and on her, was able to unlock her jaw, and she had a long-term pain relief result. And I will share some of the tips with you here, but there's a lot of different maneuvers that can be done at home that can release the jaw pain. But before we do that, we need to understand what is the jaw pain, the causes, the risk factors, the symptoms, so it will make sense what we can do at home to really relieve jaw pain. So first, jaw pain, or like the technical term, the TMJ muscle, the temporal mandibular joint. It's actually a hinge joint. You can see it here in this image that open and close like this. Let me just show it to you here. Okay, so the jaw joint, it's both sides. It's like a hinge joint. When you open and close your jaw, it open and close like this. Those joints has to be aligned perfectly on the top of each other like this. And we have a cushion, a disc that is protective to the bone on the top and the bottom, so it's not dropping bone over bone. So your jaw perfectly should be open and closed like this. That's the temporal mandibular joint. And you will be able to see it in here, the temporal bone that's on the top and here in this area, and the mandibular bone is on the bottom, and this is the hinge joint that open and close. And here's the temporalis muscles on the top and the masseter muscle, and it's very commonly overlooked that when you work on a jaw pain, you have to work on the lateral pterygoid, medial and lateral pterygoid. And that's the muscle that actually go deep underneath the masseter here, that is connected to the joint itself. As you can see here, the disc for that between the mandible and the temporal bone. So what are the causes of jaw pain? Well, first cause is, and a common cause is clenching and grinding, and jaw injury. So I had patients that fell on their jaw, they had like a hit or something like that, causing jaw pain. If you have rheumatoid arthritis, that is risk factor for jaw pain. It's very common with those patients. Osteoarthritis, under a lot of stress, because when people are stressed out, they start to clench and grind, and that's the same cause that cause jaw pain. And a lot of scar tissue in the masseter area, the temporalis area. If you have a connective tissue disease, dental conditions like any dental issues, anomaly, which is not very common, and when you understand the normal healing cycle, some dental issue could really cause the jaw pain because the alignment issue, but most likely it's the above two issues than the dental issue. Dental procedures, there's actually the length of the dental procedure and what they do in a dental procedure could increase your risk of having jaw pain or TMD or TMJ. And that is common with a lot of different dental procedures. If the dentist not familiar of how to decrease the risk factor of having jaw pain for their patient afterward, there is very high chance will contribute to the trigger of the jaw pain. All right, so what are the symptoms? So what you're gonna feel is pain and tenderness in the masseter area, right in here, and also in here. Some patient could experience earache, clicking popping in the jaw joint, and it's extremely common to have a tension headache. And I have another video on a tension headache. Feel free to check it out. So you will have a tension headache in here in this area because of a lot of grinding, clenching. Some patient could experience dizziness, facial pain all over your face, difficulty chewing, eating, and in severe cases, locked jaw, like in what happened to my wife, could not open her jaw and just stuck. And that's happened with a lot of people that do not get proper treatment or waiting too long for the release. So difficulty opening and closing your jaw. So how to treat the jaw pain? Before we go over the treatment, we need to understand normal healing cycle, because when you understand the normal healing cycle, it will make sense what we need to do to really address the source of the problem and the state of the symptoms. So our body has to go through 3 stages in order to heal. I'm gonna use external paper cut for visualization, but the same process happens internally, from clenching or grinding your teeth or any of the causes of the trigger here that will cause micro tear or tear internally in the muscle and the ligament and the tendon, and will cause a lot of issue. So first stage, inflammation, swelling, redness, the blood start to rush to that area. Then the body starts to build a scar tissue, which is happening in the proliferation stage. Our body has to build the scar tissue. It's part of our survival. If our body does not build a scar tissue, it's open when susceptible for infection. So think about scar tissue. It's like the glue. So if you don't have glue that patches the tear, it's going to be permanent tear. We don't want that. But the problem is when you have excessive scar tissue, it's in the way of everything, because our muscle should act like a rubber band. When it contracts and relax, it should act like a rubber band when it contracts and relax like this. When you have a scar tissue, it's like you have a knot in a rubber band. So when your muscle contract, it does not stretch much, and that's what happened here. When you clench, you grind a lot, you start to have a micro tear in the masseter muscle, micro tear in the temporalis, and then those muscles will not be stretchable. So you will have limited range of motion opening your jaw. You will have a lot of pain, and actually at home you can do this. Just feel these muscle. It should feel like nice and smooth. If you start to feel like a band or like a knot there, that's a sign of a scar tissue, and that will limit the range of motion and cause a lot of issue with the joint. So perfect scenario, actually, during the maturation stage, the body gets rid of the scar tissue by itself. But I want you to pay attention to something here. During the proliferation stage, there's a cascade of events. Scar tissue, you start to have trigger points, muscle spasm, tightness, and all of these has to be addressed simultaneously, because it's never scar tissue by itself, because the scar tissue on the fascia layer and tighten the fascia layer. And the scar tissue and the fascia restriction will cause muscle spasm and trigger point. So it's kind of like you have to address the proliferation stage on all aspects of the problem. So to visualize it, this what's look like supposedly normal tissue without injury. When you injure your muscle, it's gonna look similar to this. So if your body does not build the scar tissue, that is a permanent tear. But your body has to build the scar tissue, and it's gonna look like random tissue like this, patching everywhere. The problem is when you have too much of that scar tissue, it's in the way of everything. And I have some patients actually have excessive scar tissue that could compress on nerve and artery and cause a lot of other issues. So for chronic condition, usually patients are going back and forth between inflammation and proliferation like this. So I'm gonna go over briefly about, on several treatment that does not really provide a long term, and will explain it why in relation to the healing cycle. So non-effective treatment, eyes and stem, it's temporary decrease inflammation, especially the eyes. But when we look at the healing cycle, it does not do much to a proliferation stage, and it's not long-term for inflammation. Electrical stimulation is the same thing. Temporary pain relief does not really do anything to inflammation and proliferation. Foam roller, based on a study, does not provide any long-term pain relief. It's temporary, but the problem with that, if you have inflammation, you rub it, you're going to inflame it more. And that's not going to help. That's actually going to make it more worse. And the other thing is, it's impossible with the foam roller or the massage actually to go deep, to release deep restriction. That's why I have several tools to really work on that. Massage, based on the study, provide temporary pain relief. We really need to address the source of the problem, and especially when I go over the fascia layers, you will realize that massage is not gonna get there to really release the restrictions. Stretching. So if you overstretch, you're gonna cause more inflammation. So there's other alternative safe way than stretching, and I have a video why you should not stretch. If you stretch a torn muscle, you're gonna tear it more. And actually, based on the study, cause inflammation. So I actually don't recommend it for my patient. So stop stretching because you might make it worse. Strengthening exercise, we need to do a strengthening exercise. You should not do any resistance exercise for the jaw. And I hate to see it in a lot of YouTube videos. They tell you to resist, you're gonna make it worse. Please do not do that. You're gonna inflame it more, and I have other video why you should not do that. But we can introduce strength exercises during the on the right time, because if it's inflamed, you're gonna make it inflamed more. So be very careful with that, because you actually could cause a lot of harm. And I had a lot of patients went to therapists and doctors, and they start to do resistance, and it's not the best approach. And I personally try it with my wife, and it's not the best thing to do, and there's much more safer, effective way to really address the problem. So what we need to do, we need to actually address each stage. So if you have inflammation, we need to work on inflammation. If your body going back and forth between inflammation and proliferation, we need to address that simultaneously. For inflammation, I personally use the MagnaHeal. The range of the magnet field is about 3 inches. So that's what I use to decrease the inflammation. If it's mild, moderate inflammation, it works very well. So, and also I put my patient on anti-inflammatory diet, and there is a special diet for the jaw pain patient, and I will go over that in other videos. So anti-inflammatory diet, because certain food actually cause internal inflammation. I want to make sure that they're not eating food that actually make their inflammation level increase. So some of those patients, like the causes here, rheumatoid arthritis or other issue, could be related to vitamins, mineral, or hormonal imbalance. And we need to figure out what kind of deficiency you might have. Because when we look at the healing cycle, you need like magnesium, D, C, other vitamins and minerals for your body to transition from the inflammation stage to proliferation stage to maturation stage. And the only way to do that, we need to assess the deficiency properly. So feel free to take advantage of Ask ASTR. It's a free online medical evaluation. It takes about 5 minutes. The software includes at least 9 healthcare provider database to really figure out if you have issue with the vitamins, mineral, and the software will guide you on the steps on how to address that. We have to address the deficiency. If you have magnesium D deficiency, the MagnaHeal or the anti-inflammatory diet will not going to replace those deficiency. The other thing we need to work is on the proliferation stage. So we have to work on the scar tissue, and what I personally do, and I give it to my patient, is to break the scar tissue and release the trigger point. And I use the A3 to release the superficial scar tissue on the masseter muscle and the temporalis. And I use the A5 to release the trigger points and scar tissue. So lastly, we need to work on the fascia system. I will go over the fascia system quickly because it's extremely important, extremely overlooked by a lot of healthcare providers. And it will make a lot of sense why your treatment has to have releasing the fascia. when you understand the system. So the fascia system, the first layer, the superficial layer, it's like a wrap surrounding the entire body. It's like a thin layer, like a Spider-Man suit wrapping the entire body. That's a superficial layer. And you can see it here in this image. The white tissue here, that's actually the fascia layer, white web, white here. And to make it complicated, and it's actually very complex system, very complicated actually, but don't worry, the treatment is extremely simple. But I wanted you to understand, because there is different aspect of the treatment has to be addressed simultaneously. So we have two big categories of the fascia, superficial and deep fascia. And each of these categories has 2 to 3 sub layers, as you see here. So the deep fascia layer has 4 subcategories, and each of those 4 subcategories have 2 to 3 layers. So the apparatic fascia, it's a fascia layer that's wrapping a group of muscles. The epimysin, you can see it here. This is the epimysin wrapping the entire muscle. And we have here the premiysin wrapping a bundle of fibers, and we have the endomysin wrapping each individual fiber. So when we treat the fascia restriction, we have to address all these layers, because when you build a scar tissue, when you have damage, the damage occurs in all of these layers. That's why massage and foam roller does not really work properly on the fascia layer, because it's impossible to mechanically go deep to release those layers with the hand. So you can see here on the top here, the Gilla apparatica, that's a fascia layer that's wrapping the head here, and you have fascia in the back here and the front in the masseter area. So the whole head is wrapped with the fascia layers, with different layers. So we have to address all of these simultaneously while breaking the scar tissue. So what I personally do, I use the A1 to release superficial fascia layer and apparatic fascia layer, and then I use the A5 to really work on the epimysin, premiysin, and endomysin. So to sum it up, what you need to do to stop jaw pain, there's several things you can do that actually could help you relieve your pain and stop the jaw pain at home. First, you need to stop the clenching and grinding. So there's several ways of doing this, and I have another video in detail how to stop the clenching and grinding. But one of the easiest way, if you catch yourself clenching or grinding during the day, just stop. Have a sticky note in the front of you, in the front of the computer, a reminder, have family member to remind you, or alarm on your phone to really pay attention if you're clenching or grinding throughout the day. If you're chewing gum, stop it. Our jaw usually open like 3,000 times a day. So you don't want to overdo it with having chewing gum. That's a risk factor, and there's other risk factors. I go over it in other video in detail how to really eliminate some of those triggers. But the main ones, clenching and grinding and stop chewing. If you have inflammation and proliferation, we have to address that simultaneously to break that vicious cycle by releasing the inflammation, decreasing the inflammation, breaking the scar tissue, releasing fascia restrictions, while I usually give patients some exercises to really gain that range of motion without resistance, because with resistance you're gonna actually cause more damage. So if you have any question or comment, leave it in the comment section below, and I will see you soon in the next video.
Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below, or go to ASTRinstitute.com.